Yet. Hello, everyone. Welcome back to That Goes Live. My name is V. I use she and her pronouns, and I am a member of the Trans Health Access team here at Thundermist Health Center. For those who aren't familiar, the Trans Health Access team provides care for our trans and gender diverse patient population. We help patient issues in particular with everything from coming out to communication skills to case management assistance. And we do that through the help of our Trans Health Peer Navigators, who I'm joined with this afternoon, Logan England and Tony Octera. Um, Hello. It's great to see your beautiful faces. I would love if you two could introduce yourselves and let us know, who are you?
Shall I go first, or you want to go, Logan?
Absolutely. Go ahead, Tony.
Okay. Hi, my name is Tony Octera. I'm a peer navigator at Thundermist. I'm pretty new. I'm the newest member of the team here, but I've been with Thundermist now for about 2 years. I started out working in reception and finally got the job of my dreams, working with the trans community. So I'm also trans. And I've been in transition for quite some time now. But I did start later in life, for a whole bunch of other reasons that we'll probably touch on a little bit later. And it is the most wonderful job in the world for me, to be honest. Right now we're working in my house. We all are, because of the COVID-19 thing. So we're kind of isolated ourselves. Thank God for electronics. This is such a great opportunity to see people that we don't normally get to see during the COVID thing. And it's just wonderful to be here. Thank you both very much.
All right. Hello. And Logan, who are you?
So my name is Logan England, and I am the pediatric Trans Health Peer Navigator. I usually work with our clients who are 21 and under, especially if there's still family or school involvement. So that I work as a peer navigator, both as a peer to the trans youth and a peer to the parent, because I am not only transgender myself, I'm also the parent of a trans young adult. I like to knit and crochet, and I love coffee and my cat and horror movies. So that's about my whole personality summed up there. I've been at Thundermist for 2.5 years. And I absolutely love my work. I remember telling my supervisor at the interview that I would take this job if it was a volunteer position. I thought it was such important work, and I still feel that way. It's really important to me to be able to help our clients have things to support their transition that I didn't have when I transitioned 20 years ago in the South. So.
It's so amazing that both of you are here. It has really been a wild week. We ended last weekend with the president saying that trans healthcare rights were not protected. And come Monday, the Supreme Court says, oh no, LGBTQ people, which includes trans people, cannot be discriminated against when it comes to employment, meaning you can't be fired for being trans. Those are big strides for our community. And more than that, it is stuff that very much affects me as a trans person, you all as trans people, and the many trans patients that we work with. I think a lot of times it's really easy to think about us in purely clinical terms, but at the end of the day, we live in a world where we need to work together to make it more just and better. And with your work, I think you really do get to help a lot of trans people live the life that they really want to. So with that being said, please explain to me, what exactly is a Trans Health Access Team Peer Navigator? What do you do?
So we start the process from, we do outreach calls to our new patients to tell them about the program, to see if they have any questions before they're, or their initial appointments or if they have additional needs. We provide support for our clients out in the community, and we help with the legal process of your name and gender marker changes, in that we guide you through the process, help you get together all the appropriate documents to take to court for your name change. If you're nervous and feeling unsupported, we can escort you to court to give you, some peer support while you're there, and then walking people through the additional steps of the next move to Social Security and then the DMV. I bring my knitting, and if we're there at the DMV all day, that way you don't have to sit there alone. That's something that right now, some of our role has changed a little with the COVID situation, and that unfortunately, one of the services that we have provided in the past where we would transport patients to these appointments. Right now, we can't transport because alone in the car, there's no social distancing in the car, but we still can meet patients at appointments and be there at the appointment to support you. And if that's not something that, say, if you have a consult with a surgeon or an outside provider and need some support, even if they say, oh, you can't bring guests to the appointment with you, you're welcome to call us and we can be in on the appointment through, speakerphone. So we just provide that extra support for people out in the community, and we address issues such as housing, food insecurity. We connect you with resources. If you need things that Thundermist does not provide, we will make sure you're connected to those resources out in the community to get your needs met.
That is an immense amount of work that you do. And I truly believe that in order to have a good healthcare center, in order to have good health in the world that we live, that care can't just be inside the walls of our center. It really does extend to everything outside. And trans people do more than just get medical care or see a therapist. They have IDs that follow them everywhere we go. They have medical needs that are being debated all the time legislatively. And because of that, I'm hearing you say that your work takes people to where they need to be in order to live a great, healthy life as a trans person. Tony, you said that you joined recently, right as the pandemic began. How do you see your role as a peer navigator?
Well, I'll tell you. So a little bit about myself and why I got into it. When I first started transitioning, my focus was on the medical aspects of it, which is the hormone replacement and several surgeries I've had. Okay. When I first started transitioning, I didn't utilize a peer navigator. So it was like kind of pioneering everything myself and trying to do the best with what I could find online, etc. And then in what order to do them. So the name change, as example, going down to DMV, going to the Social Security office, all those things were very tense for me personally. I think until you do them and you realize that they are doable and there's no real reason to be too nervous about it, you're changing a lot of aspects of yourself. So, I mean, I think a certain degree of nervousness is to be expected, right? But it's great to have somebody to lean on and to run ideas by and run your feelings by while you're going through this. And to have us accompany you if that's something you would like. Or if you just need the nuts and bolts of how to do it. The reason I got into the work I'm doing right now is to try to help other people not go through some of the mistakes we all make as we go along. Okay. And I think that's critical. And it's a resource that you really should take advantage of. It doesn't cost anything. We're here for you. And, there's nothing expected in return except for you to succeed in your transition. I honestly can't tell you how much the job does for me personally in my own transition. To be able to meet people and work with them, and so much brings me back to early on when I first started. like every day I get brought back there, and I'm like, oh God, yeah, I remember that. I remember going through that. So we can relate with a lot of things, I think, both Logan and myself. And we're peer advocates. The word peer, we're part of the community. We're part of you, you know? So you're not talking to someone who doesn't get it, who hasn't been through it, or who just read about it in a book. We've lived it. So I think that's critical too.
Adding on to what Tony said, a lot of trans people don't get some of the critical health care they need, even if they're patients at Thundermist and they come to their PCP appointments and they're getting the gender related care that they need. The idea of having to see an outside specialist that doesn't know you can be really intimidating and fearful, and people will avoid some of those appointments, and that can be critical for our health. And so being able to provide the peer support to go with someone to those appointments and be able to know that if you walk into an appointment and they misgender you, or you're standing at the front desk and they start asking you uncomfortable questions about your body parts, or, you know, that are the type of things that trans people fear and the reason they avoid going to doctors, that we're going to be there to support you. We're going to, you know, help you answer those questions in a way that empowers you, so that you're not dealing with all that emotional labor of having to be your own advocate for your health care and avoid getting the critical health care that people need.
It is really critical that we consider that every aspect of healthcare that we interact with is a place where you should be deserved, or where you should be treated humanely. You should be welcomed into a space that is doing something very vulnerable with you. They're caring for you. They're trying to make your life better in some medical way. And I don't think you can receive proper care if at the front desk you're not being called with the right name, or if they're using the wrong pronoun. So I'm really glad to hear that from both of you. Tony, you touched a little bit on why you wanted to become a peer navigator, and Logan, you said that you would have even wanted to volunteer as a peer navigator. Knowing what you know now, knowing what your position entails and the kind of interactions you have with our patients every day, how does your experience in healthcare shape what you do with our patients? How does your experience with healthcare help you help others?
You know, we have learned so much through our own lives about kind of what to expect. I remember my first mammogram I had. It was to an outside provider. I went down to a hospital to get my very first, very exciting experience. And their front desk, it wasn't part of Thundermist, it was an outside place, but I was so uncomfortable for that experience. They misgendered me. I had my old ID at the time, and I was trying to get them to call me by my name that I've chosen. And it took me a good 15 minutes to get that across. And then I got told that, well, we're going to call you what's on your license. So, you know, and I was alone at the point. I wasn't with anybody. So it kind of took me back. And I remember those experiences. And I hate to see somebody else have to go through that. So I worked in reception in Thundermist before I took this position, and I've met so many trans patients come in the door. And I get excited every time I see someone come in the door, because my first thought is they're going to have a good experience. Okay. Our receptionists, whether they're trans or cis, are all attuned to what the trans community is about, what the pronouns are about, how important they are to us. And they have a lot of meaning. Those are titles that we've earned, whether it's she or he. You've worked for that, you've strived for that, and you want people to respect that. And that's just very tip of the iceberg. There's so many other reasons to do this job. I can't describe how rewarding it is. And I honestly can't wait till COVID's over so I can see people face to face again. I talk on the phone. I think Logan does most of the day, which is great that we can do that. But I think we're all striving for that. We're looking forward for that normality to return.
I think I'm in a unique position, a little different from Tony, in that when I work with both the youth and their parents, I can, just the fact that I exist and I've survived and that Thundermist exists can provide a level of reassurance, especially to parents, that one of the biggest fears that I hear consistently over and over again is not even, I don't accept my child for who they are. It's, I accept this child for who they are, but I'm so scared to let them out into this world that won't accept them. I wish so much that they could go with the flow and be quote unquote normal so that they were accepted and not of fear and violence, or that I didn't have to worry about their safety for the rest of their lives. And I think that just seeing an slightly older, but still remarkably handsome trans person can show them, okay, my child is not destined to have all these negative outcomes that we hear about in the media and that have happened historically for trans people, and can break the cycle with families of thinking that being trans is what causes all of these frightening outcomes, rather than it's society's reaction to trans people that creates these outcomes. And so having our support, having the support of a place like Thundermist, gives some hope to parents that the trend is changing and that their children are going to grow up in a safer, more affirming world.
Safety is really key. I think about how much before my time, healthcare for people like us was nearly impossible. And I love hearing you say that it shouldn't only just be a safe and welcoming experience. It doesn't have to be a lonely experience either. And I think for myself, that's really easy to forget that I want to feel like I can belong in this world, but there are steps that revolve around healthcare that I need to take. And having someone by my side, I think, would have gone a really long way for me. It would have saved me a lot of trouble. But I want to shift over to, I don't know if I'd call it a role play, but we're going to play with some scenarios. For this first scenario, I want us to pretend that a new adult is coming into Thundermist for the very first time, and they are wanting to seek healthcare from the Trans Health Access team. This person, as an adult, doesn't really have the support network that others might have, and they need a little assistance from the peer navigator to get the care that they deserve. What does this person need to know?
I think one thing they should understand is that every question that they're probably going to ask, we've heard numerous times. We've had those same questions ourselves in our own lives. So I think a lot of folks don't really know where to begin. So transitioning, the social aspects, the aspects of being alone. Why are we alone when we first transition? When we come out to our families, which is usually the first things that happen, family and friends. I found in my transition that I had to come out to everybody. I didn't move. I live in the same house I've lived in since 1990. Same neighbors who knew me in my past, the way I presented in the past, and they also know me now. So the mail lady who delivers, the guy who fixes my oil burner, the plumber, the lady at the grocery store, all these people are the same people that I knew for the past 20 some odd years. So every time I met one of them, I was coming out to them. And it wasn't a choice of I want to, because I presented completely differently. So I think the thing with transition is to know where you're going to get started. The fears are all there, and they're all justified to a degree. I was terrified. I was terrified the first time I went to my mailbox to pick up a letter down my driveway, saying, oh God, who's looking out the window? The neighbor, Gladys Travis, is looking out the window, right? She's going to see me walking down the driveway. I will say this: it does get better in time, and it has it helps talk to other trans people about that. Sometimes you're the first trans person that a patient will meet. Sometimes they don't know anybody in their working environment or their school environment that they've come out to yet, and they've never talked to other trans people. I think sharing experience is the most valuable thing you can do. Whether you do it through a peer navigator or through one of our groups when we meet, it's critical. And I think we can help you get into that groove, so to speak.
Tony, to quickly follow up, earlier you shared that you transitioned a little bit later in life.
Yeah.
What do you think patients who are wanting to transition later in life, what should they know?
Well, the thing about transitioning later in life is you sort of have established who you are through the years. We've formed who we are. Personally, I've come to the conclusion that I really wouldn't change anything because I wouldn't be who I am today. So you take the good with the bad. But later in life often involves a spouse, a partner, where younger folks worry more about their parents and, their siblings and such. But coming out, I'm married. I came out to my wife after being married for years. And so, yes, it was really precarious. It was scary for me because I didn't know really, I know her, but I didn't know what the reaction would be. It's a big life change. We're still together, so that's the good news. And I think being able to relate to that as a person who has come out later in life is so important. Your dynamics change. You have different things that you have to look at. I have a mortgage that I had to change my name on. I had credit lines I had to change my name on. I have a will that all that had to be changed. So once you think you get past the license and the social security card, there's still lots of other things. So with me, I'm still seeing things today. I'm like, oh God, yeah, I never did follow up with that. I gotta take care of that. So that's the thing that happens later in life. You are more established, and so the changes, I think, are more profound in a way. It's different. It's different, but it's never too late. I will say that. I'm living proof of that. And I've never been happier in my life. It was the best thing I've ever done. And I think coming out gives a certain degree of relief to people once they do it. It's not always easy. Logan, do you have anything you want to share on that?
Well, I know that we've had some patients that call us that we do outreach for people who are in their 70s and their 80s who come out. So it is truly never too late to decide that you need to live differently and to live as your authentic self. I was also a little older. I was 30 when I began the medical aspect of my transition, and I had small children. And so there are considerations that you think about as an adult and as a parent that you don't necessarily deal with in your teens. Just like the idea that my dead name was on my children's birth certificates. So anytime they needed to go to a doctor or something like that, I had to still carry my name change paperwork because I had to prove that I was that same person that was listed on their birth certificates. But like Tony, I wouldn't go back and change anything. I am the birth parent of my oldest child. And while that was really difficult in ways, and it triggered a huge amount of dysphoria, which was kind of my wake-up call in my decision to transition, I wouldn't go back and give up that experience for anything. I think that we're all an accumulation of our experiences, and so I'm pretty happy with the package that I have ended up with in life, and so I wouldn't take away any of those experiences now. And I think that having the ability to share those experiences with our clients, both to reassure them that it gets better and to guide them along the difficult aspects, to smooth the way on some of those it just reaffirms my feeling that I'm really happy that I've gotten to live the life that I had, because now I can take those experiences, even that were really tough, and find great benefit in them, and that I can help our clients around some of those same issues.
Oh, I'm a little emotional.
Oh.
It's really hard when you do work that is personally affecting you as well. I think we heard that from a lot of our BH clinicians last week, where you are oftentimes experiencing the same anxieties that the patients you're working with are feeling. And you help people with so many issues, right? Everything from getting your name changed to accompanying people to consultations to the DMV. I, it's a lot. And I think it's also critical to know, what issues do you not help people with?
Um, so for me, we do case management, and what that means is that we kind of act as care coordinators if you're involved with several different agencies who are supporting you or your family in some way. If you're getting, seeing outside therapists or doing a program, that we help coordinate that care. We talk with all your providers to make sure that all your needs are being met and that everybody's conversing with each other. But some agencies that provide care coordination can do a little more in that, say, if you need a representative payee for your Social Security, that's not something that Thundermist can provide. Um, right, and we've had some changes in our program due to COVID-19, in that right now, if you needed to meet with one of us one-on-one, it would need to be something that was pretty important and urgent for us to get approval to do that. And we would have to do it outside. Like, we could come to your house and stand in the yard 6 feet away from you, but we can't go inside and we can't transport. But that said, if you do need us, let us know. And one thing that I do get asked fairly often for help with, that is one thing that you do need to call the call center for, is prescription refills. So somebody will text and say, can you ask my doctor to do this? And you really do need to call the call center for a prescription refill. Also, when people want to get enabled on our web portal, which is a really great thing to do, because there are lots of things you can do on there. You can ask for prescription refills, you can message your provider, you can schedule appointments. We are not able to get people signed up with the web portal. You also need to call the call center for that as well.
All right, and Tony, do you have any thoughts on what are the kind of issues that you do not help with people, that you do not help people with?
Well, I'll preface it with saying that I don't think there really is a stupid question or a question that shouldn't be asked. I think we're open to being asked whatever the person, the contact, needs to know. There is a clear delineation. So we are professionals. We are in the health field. So we try to maintain a professional stance in everything that we do. We do have guidelines that we adhere to, HIPAA guidelines, and other formats we try to follow. So we are here as a sort of caregiver, a peer caregiver, and to help sort of pave the way for you in your transition. If there are other things that are not transition related, we may be able to point you in the right direction and try to get you somebody who could help you with these things. Because we don't have all the answers, but we can usually find out what the answer might be. So that's why I say there's really nothing, I think, out of control to ask. You should ask. And if it's not something we can help you with, we'll make that clear that we can't, and we'll try to recommend something that you can do. I see a lot of stuff with relationships. We don't normally deal with relationships as such as counselors. We don't do counseling, but we could certainly point people in the right direction. We talk to the behavioral health therapists all the time, so we have a feel for what's going on and what folks need. I just want people to feel free and easy to make a call, to ask to speak to one of us, because it really just takes a phone call to reach one of us, and we will talk to you and figure out what's going on, and try to help as best we can.
And I think Tony touched on this a little bit about communication. And I think this is an important thing to note is that we will occasionally have clients or, our patients ask us, the best way to get in touch with me is actually through Instagram DM or, Facebook or they'll send, Facebook friends requests, which is always, I love that you want to share that part of yourself with us. But we do have really strict guidelines at Thundermist that keep that professional divide. And so we are not allowed to accept friend requests or respond to messages that we receive on social media from clients.
I think that makes a lot of sense. You are there to provide care, and you do it professionally and with respect. How do patients get into contact with you? If they are a patient at Thundermist, how do they reach out to you?
I think the call to the call center, our main number, if they call that number and ask to a peer navigator, we will end up getting a message on that, and we will return the call. A lot of times that's a new patient looking to establish themselves here. So with COVID-19, we're doing things a little bit differently with the trans community. If a new patient was to approach the call center and ask to set up an appointment for a PCP or behavioral health, a lot of times they'll forward the call to one of us, so we could get a fit with a good therapist and a good doctor and try to get them rolling. We do a little bit more at home, like as far as doing registrations, we can do some of those at home. That'll probably change once COVID ends, and they'll have to go in the office to do that. And that'll be great because that'll be normality. But so right now, they can reach out through the call center and ask for a peer navigator and just briefly what they need to talk to us about. And we will return the call.
And I know sometimes the call center can be backed up there. We have with the COVID situation, we have a lot of people who have needs and questions. And so if you're on a lunch break at work or whatever, and you don't have, several minutes to sit on hold, or you feel like it's urgent, you can reach out through, we have an email address, which is transhealth@thundermisthealth.org. And that goes into a email box that either one of us has access to that we can get. We do have individual emails as well, which are listed on our website. A lot of people have our phone numbers, our direct numbers, and that's great. And if you are someone who has our number and you need somebody, if you have a friend or somebody that needs to get in touch, feel free to share that. I'm sure everybody's got a pen and paper right now. Mine's 401-408-9602. You can also text us at that number. And if you are web portal enabled, so you do call the call center for that and ask to sign up for the patient portal. And then you can send a portal message right through the app that you'll download, and that will get to us as well.
So ultimately, if you can text or call, you can get in touch with a patient can get in touch with both of you. And
absolutely.
And I think that sort of ease and access is really important for a lot of people. I know that I can get confused when it comes to healthcare, and when things just pile up, I can just get frozen in fear and feel like, oh my goodness, I don't even know where to begin. And from what I'm hearing both of you say, just place that call to the call center or call either of you directly. And, everything that seems huge can be done one step at a time. So we have been talking about what an adult might expect as a patient at Thundermist getting trans health care. Logan, Tony, that is amazing. And I also want to know, how does it change if you're a minor under 18? Is it different?
So there are a couple of different aspects if you're a minor. in that we do involve your family because we hope that the whole family will be involved with healthcare at Thundermist. So if I get a message that we have a new patient and that patient is under 18 years old, when I do the initial outreach phone call, I will call and ask to speak to the parent. And once I have permission from the parent to speak alone with the child, I'll kind of go over with the parent, about making sure you bring your insurance card and that there are forms that need to be filled out, the legal aspects of care. But then I will talk to the young person with their parents' permission and tell them about our wellness events, give them some information about some other resources like Youth Pride that are really vital to helping our youth here in Rhode Island. Um, and so the things, if a young person, things that they disclose to me, they're confidential. I'm not going to share those things with your parent, but I do have to get the parent's initial permission to have individual contact with a youth. And so I do have some youth now who are, especially kind of the older ones in that little space between 16 and 18, who we do have a form that a parent can sign for older youth to come to their own appointments by themselves. And so, they'll text me themselves and be like, "Hey, I'm going to be late because I'm, getting off work late or what have you." And so, after that initial contact with the parent, then the youth and I can have direct contact. Um, when we go back to being able to transport clients, I absolutely cannot transport anybody under 18 without a legal guardian also in the car with us. So if it was a youth who had a need to get to an appointment, I can take mom or dad or whatever, or a parent or grandma or whoever that youth lives with us, but I can't transport a youth by themselves.
And I will say that normally I defer to Logan with the younger trans patients. That's more or less Logan's specialty. But what ends up happening a lot of times, if a trans person were to call and they want to talk to a male or a female, that's where we're able to be a little bit more diverse with that. I'm more than happy to talk to anybody. Logan is basically in charge, or he runs our youth program for trans youth. But I'm certainly somebody that's there to talk to them as well. I registered a 16-year-old yesterday, a trans patient whose mother I talked to, very supportive. And that's the other thing about trans youth. Yeah, we play a role, but I think the families play such a huge role. And I would just like to speak to that and say that if there are parents of trans kids out there watching this right now, you have such an incredible amount of influence on your kids and the opportunity to make such a difference. We'll also talk to people who want to learn about trans kids. If a parent was to call up and try to get information, I don't know where this is going. I don't know what this is about. I don't know what my child wants to do. So we're there for that too. We're a source for a lot of information with kids and adults.
We also go into the public schools and we do trainings around cultural competence and diversity in the school systems. And so the schools, the principals or whatever will request that we come in, and I do a lot of those trainings. I did several around the Woonsocket schools last year, and we can do that around athletic teams or workplaces or in any place that, the companies or organizations that call and request us. But Tony was absolutely right in that if you are a trans feminine person and would just feel a lot more comfortable talking to somebody who has a, feminine identity that can relate more with you, it doesn't matter your age. If you call and you're like, "Hey, I want to work with Tony," that's totally fine. We really just want everybody to feel comfortable and safe and affirmed. And so we're not rigid in that, oh, if you're under 21, you have to work with Logan, or if you're older, but you need somebody that you relate to more, no, you can't talk to Logan. It's not like that. So
I think there's a lot of cultural anxiety about trans kids in general. I know that for myself, I had to wait until I was an adult, until I was over 18, in order to get medical care to transition. And I do not think that my parents would have allowed me to as a minor. And in that way, I think a lot of trans youth can have a lot of anxiety about having familial support. And because of that, Tony, you kind of touched on this a little bit, but what role do parents and family members play in a young person's transition?
I think it's a pivotal role. One of the big fears I see with younger trans people is coming out to their families. It's like such a huge hurdle. Um, to a degree, your mom and dad or your guardian has some control over your life when you're still living under their roof and you're still underage. Um, Plus, the fact is that we all want to be loved and accepted by our families. And I think that's such an important dynamic. It's not all that different from, a spouse wanting to be accepted by your spouse for who you are. But for a child, I think because there are certain controls in place that the parents have, it's critical. And I just encourage people to learn about what transition is and what trans people are about. There's an awful lot in the media today. There's a lot of political stuff going on right now, too. Most of it this week has been really positive for the LGBTQ community. So we've made some really good strides with getting rights, and that applies to everybody. Through a trickle down, it'll be for kids, adults, everybody. And I think that's wonderful. If somebody has questions about how to come out or what to expect when they come out to folks, I think we could be a resource for that too. I know that, using my own experience, everything's anecdotal. I always fall back to my own experience. When I came out to my wife, I remember thinking, oh boy, here we go. And in the beginning, it was like a roller coaster. Okay, so it was an up and down. Some days it was really okay, and some days it wasn't so okay. Some days she understood, and some days there were a lot of questions, and justifiably so, I think. For me as an adult, it might have been easier than if I was a child to negotiate that. We want acceptance so bad, but yet we can't stand it. We have to work at it. And I think that's a job for the family as well as the trans person to work at. It's not one-sided. You have to be patient. You have to expect people to be people. Not that you have to sell who you are, because you are who you are. But to win over that reputation is difficult sometimes. And I say be patient with it and give your family time to adjust to what you're telling them and what it means to them. I know I've heard the comparison to, let's say, a male transitioning to a female. It's like almost like the loss of a son, but it's also like the birth of a daughter, right? So there is a sense of loss with a lot of parents with a child who transitions because they know you as who you are, And I think that has to be understood to a certain degree. So it's a mutual empathy that we have to have back and forth to make it work and to get that respect.
And it's not just that as trans people, we want to affirm other trans people, but the research that is coming out in the last few years shows beyond a shadow of a doubt that when young people are socially affirmed in their gender identity, the suicide rates plummet. So family affirmation is literally the difference between life and death for trans youth. So you want to touch on a little bit. Tony made so many great points there that family members, especially parents, when your child is born, whether this is right or not, you immediately are already projecting into the future and thinking about their wedding day, their graduation, how cute your grandchildren are going to be. And so, again, whether right or not, we create a lot of expectations. It's not just that child's life, it's our vision as a parent of what our life will be parenting that child. And when that changes in a way that feels very drastic to us, um, parents need a moment to shift focus. It takes some time. And while it's not appropriate to put that on your child or have that be a point that feels like a point of contention or a point of guilt, um, as an extra burden onto that trans person, it's still important that there are feelings that the parent is going to feel that they need some time to sit with and work through to get to a place of acceptance and support so that they can be a strong ally for their child.
Absolutely. The research that says that when trans youth have support of their family and their community, right, the suicide rate does go down. And I think that means there's abundant potential to go on and live happy lives. And although I'm not a parent, I can imagine that every parent wants a child to live a full and healthy life. And by getting care at Thundermist, by doing that internal interrogation and reflection of what did I think my child was going to be and who are they now, they can ultimately be happy and well. And I love to know that although we share a lot of anxieties as trans people in the world, there are a lot of joys that I believe we feel because we have transitioned and because we live the life that we truly want to. So I'm going to ask you one last question as we wrap up. Now that you're a peer navigator and you give help to so many people, is there anything you would tell your younger self about transition?
I've had it asked me by people I know, like if I have any regrets about transition. And I'll tell them, yeah, I have one regret. And the one regret is that I didn't do it years earlier. So when I was 16 years old, and I don't want to date myself too bad, but it was not something that would have been readily accepted. I'm from a very religious family, and I think back in the day, it would have been super tough. Um, Times are changing. I think people today need to be encouraged by the good things that are happening. Your transition is not supposed to be an arduous, painful experience from beginning to end. There are tough times through it. Anyone who says that there aren't hasn't been through it. But there's also some of the most joyous experiences that you will ever have in your life. I have never been happier. Most of the trans people I know have never been happier. You get to be yourself. What can be better than that? So this is a great opportunity. It's a great time. COVID-19 or not, we're going full speed ahead with this. So if you're looking at signing up or learning more about Thundermist, we're the people you want to talk to. We welcome you with open arms. Don't be worried. We have great senses of humor. We've heard it all. We'll even laugh with you on the phone. I laugh a lot. So, yeah, and be happy about who you are. You're one of the rare special people. You know what I'm saying? I call us the diamonds. We're the rare ones. We're not all over the place. Be happy about that. Rejoice in it. And go for it.
Yeah. I'm going to cry.
Don't cry.
I am a diamond. I will tell myself before I go to bed tonight, I
Uh-huh.
am a diamond. Logan, how are you going to make me cry? What do you wish you could have told your younger self as a peer navigator?
I'll date myself a little bit. I grew up in the 70s in the deep, deep South. And there was, like Tony mentioned, there was a lot of religious dogma in my family and in my community. And very heavy expectations of what gender roles would be. And I was aware fairly young that I didn't fit those, and it started being a problem for me, both in my family and in my community at a fairly young age, which led to, a lot of bullying and trauma, even in elementary school. And so I don't have regrets about the path that I went on for my adult self, but I would go back and I would tell that miserable little kid that they're not sick, that there's nothing wrong with them, that they're worthy of love, and that the reason that they are treated poorly is not because they deserve it, but because the other people around them are wrong. They're not the one that is wrong. And to hold on tight and believe in your own worth, and um, your time to blossom will come eventually.
Oh my
And
goodness.
so that's what I want our kids, our young people that come to us, and all of our people to know that um, the world is changing. The world is starting to realize that um, gender roles are silly, and they're not, you know, people get caught in such rigid mindsets about certain things. But if we look at what the world was 100 years ago and how we expected men and women to dress, people are starting to wake up to the idea that, wait, oh, all these cultural things that we treat as absolute truths are really just a sign of the times and our temporary culture, and that we are the ones that change those. Oh, wait, you mean we get to decide what this is? And opening up to that. And so hold strong. Don't, you're okay. You are beautiful and worthy and deserving of love. And we are here to support you on your journey.
Oh my goodness. I wish I had heard that when I was younger. When I was younger, I was told it gets better, but I wish I had known that at times it was going to get worse, and it was all part of the process. That as the world changes, as we can dictate the change in the world, we can also change ourselves and be celebrated for that. Um, I'm so glad I got to talk with both of you this afternoon. I am really emotional because I think the work that you do is really necessary. And I think, healthcare centers and hospitals all over the world would really benefit from a peer navigation program like this. At the end of the day, you want people who know what you're going through to be able to be there when you get care. I think that's really critical. I think that's really crucial. And I'm so thankful that we have you two as peer navigators to help us live our best lives. With that being said, is there any is there one last thing that you would want our patients to know? Logan, you go.
If you need help and you're not sure that we're the appropriate place for you to call us anyway. If we're not the ones that can help you, we'll help you find out who can. But don't let fear stop you from reaching out. We are here to help you.
Yeah, I'll just add to that. I think that says it all. But yeah, feel positive when you do make that call, when you decide to make the call. And I know the first time you reach out to talk about transition, it's kind of unnerving. But when you talk to one of us, you're going to be talking to another trans person. There is no judgmental. There is no right or wrong or set way to transition. Okay? Ultimately, you as a person will decide how you go about this. We are certainly not judgmental. We can maybe tell you some of the options that are open to you, but your transition is yours. You own it. You are the captain of your own life. We're just here to help you navigate some of it, if we can, right? And we certainly will try. And I want to thank you too for having us here. It was a great opportunity.
I hope many of our patients get to know both of you, and Thank you both so much. I think this is the end of our video. I hope you have a happy June. I hope you have a safe June, and happy Pride.
Happy Pride,
Happy
everyone.
Pride.
Right.
Yeah.
Right.
Bye.
Bye.
Bye.